Hello, everyone. Thank you so much for joining us this afternoon. My name is Liz Hipple. I'm Senior Policy Advisor here at the Washington Center for Equitable Growth, where I lead our work on economic mobility. So I'm particularly excited for this afternoon's session, New Insights into the Role of the Social Safety Net in Economic Stability and Individual Well-Being. We have a lot of great papers that are being presented here today. And I'm going to start off by just going kind of through the run of show and sharing some logistical details for folks so that we know what the plan is, and then we can head straight into the papers. So first up, we are going to have, is the social safety net a long-term investment? Large-scale evidence from the food stamps program, presented by Hillary Hoynes, who is the Haas Distinguished Chair in Economic Disparities at the University of California, Berkeley, as well as a new steering committee member here at the Washington Center for Equitable Growth. So we're particularly excited to have you here today, Hillary. The discussant for that paper will be Manasi Deshpande, who is assistant professor at the University of Chicago. Then we will have tax refund uncertainty, evidence and welfare implications, presented by Scott Nelson, who is an assistant professor at the Booth School of Business at the University of Chicago. Then we will have welfare cuts and well-being, evidence from Indiana in the Great Recession, presented by Derek Wu, who is a PhD candidate at the Harris School of Public Policy at the University of Chicago. And then the discussant for those two papers will be Alex Bartik, who is assistant professor at the University of Illinois at Urbana-Champaign. So just a reminder to all of the presenters, you will have 10 minutes for your presentations. Discussants, you will have 5 minutes per paper. I will verbally interrupt you when you have 2 minutes left to let you know that it's time to begin to wrap things up. And so a reminder to all of our audience members that we will still have a very healthy 20 minutes at the end for questions from the audience. I'm really looking forward to those. So please use the Q&A button that you see at the bottom of your screen to be submitting questions throughout the presentations and discussions. And we will be taking those at the end of the session. And also just a friendly reminder to everyone that this session is on the record. So for journalists and non-journalists alike, we encourage you to tweet and share and discuss amongst yourselves. On social media, you can join the conversation using the hashtags #EGGrantee and #EG2021. For the social media handles of all of the participants in this session, you can go to bit.ly/EG2021_SM. Again, that's bit.ly/EG2021_SM. I realize that's a mouthful, so I will also put that, try to get that into the chat box for everyone's reference. And so we will be sharing highlights and from this and the other on the record sessions throughout the conference from our handle @Equitable Growth, and we encourage you all to follow along. If you have any questions, and this goes for everyone, if anyone has any questions about the research presented here, or you're interested in connecting with any of the participants to talk further, please do reach out to us at info@equitablegrowth.org, and we would be happy to connect folks so that this conversation can continue beyond today. So with that, housekeeping out of the way, I am going to turn it over to Hillary Hoynes to present on, is the social safety net a long-term investment? So Hillary, if you want to go ahead and start sharing your screen.
Thank you very much. Thanks for having me. So I'm delighted to talk with you about some work that I've been doing with my co-authors, Martha Bailey, Maya Russin-Slater, and Reed Walker. And the sort of starting point for our analysis is the observation that a very common way of evaluating human capital programs is within a sort of investment lens. So we expend resources up front, for example, on preschool education, and we quantify and are patient for quantifying the returns from those investments that may accrue over the long run in education, labor market, and health domains. And in this work, we sort of start from the observation that that is not a very common way of thinking about the social safety net. And our work and the work of many other scholars in a sort of emerging space is attempting to quantify to what degree we can think about the social safety net as an investment, particularly in children. So in this paper, we evaluate the long-run impacts of childhood exposure to the food stamp or SNAP program and impacts on the longer run in terms of effects on their health and economic well-being. And in particular, we pose questions and try to gain some insights into the degree to which that assistance, to what extent it changes an individual's life trajectory, and does age of exposure matter? So just as a very quick summary of the SNAP program for those who might not be familiar, it is a central feature of the US anti-poverty social safety net and has been since its beginnings in the Great Society period. It's a means-tested program. One has to have low income to be eligible. It provides benefits to households with and without children who are needy, particularly important, of course, during this COVID crisis. And benefits average to be about $4 per person per day. And shifting to thinking about SNAP within the social safety net for families with children, we find in the National Academy of Sciences report that I had the pleasure of being part of, that the SNAP program is the second largest anti-poverty program for children in America, just after the tax credit. So it's a critical element of the social safety net that is essentially today distributed through debit cards that allows households to purchase essentially all food items in the grocery store. And so what we're doing in this paper is analyzing the beginnings of the food stamp program in order to evaluate its long-term impacts. And so we go back to the Great Society period when the food stamp program was rolled out across counties in the United States over the period from the early 1960s through the middle of the 1970s. And the map on the left there just gives you, in this very short time that we have today, just a glimpse at the timing of the rollout across counties, with the lighter shaded counties showing places that were implemented earlier in the time frame versus the darker shaded counties later. The chart on the right gives you an idea in the aggregate of how quickly the population in the United States was exposed to food stamps in terms of just the population share across these counties. And you see a remarkable sort of linear expansion in the share of the population that had access to food stamps in between 1964, when the Food Stamp Act was passed by Congress, and through the middle of the 1970s. So what we do in short is combine a new source of data where we combine both survey and administrative data within the census infrastructure. We use the 2000 the 2001 and 6 long form census data, along with 14 years of the American Community Survey. And each of the observations in those data sources are merged to the Social Security numinant file, which records county of birth, date of birth, and if one is passed away, date of death in the numinant file. And we create in this linked survey administrative data a sort of comprehensive current period measure of a range of both health and economic well-being measures. For example, we have measures of human capital, economic self-sufficiency, health, the characteristics of where individuals live. Also, we examine impacts on mortality, and using information in the census, also a measure of incarceration. So essentially, we take this variation across counties and over time and use that to evaluate the effects of the food stamp program on children and their exposure in the 60s and 70s, using, in essence, a sort of difference in difference kind of design, with using the variation across place of birth, using the county information in the numinant file, and date of birth, in order to examine the impacts of food stamps on long-run outcomes. And just to make a few estimation details, the first is that We're only observing people in the 2000 census and later. We don't know about individuals' family well-being during childhood. So this is going to be an intent to treat analysis. And I'll show you some treatment on the treated estimates by scaling up our intent to treat estimates by measures of food stamp participation from that historical period. And because we have many different outcomes to examine in the decennial census and ACS files, we cluster the outcomes in domains and estimate standardized indices. That was first done in the Kling et al. 2007 paper, where we've got equal weighted averages of standardized outcomes where we minus the mean and the standard deviation of untreated cohorts in order to calculate an overall index of impact. And so the results for those indices will be in standard deviation units. So here is a sort of important event study set of findings that I want to just kind of walk you through. And so the first thing that we do is take all of these outcomes from health, from human capital to economic self-sufficiency, disability, and neighborhood, and we put them all together into one composite index. And we estimate an event study where the x-axis is event time, where we have event time as the age that the adult that we observe in, say, the 2000 census, and how old they were when food stamps was introduced in their county of birth. And the event study traces out relative to the omitted age of age 10, the impact of exposure to food stamps on later life outcomes for these children that were exposed. And so as you move towards the origin to the left on the x-axis, we're tracking the impact of being exposed to food stamps a year earlier in your childhood. And the impact here is on this composite overall outcome across all these health and economic outcomes. And the punchline from these findings that we find quite consistently throughout individual outcome measures is that the impact of food stamps in the long run impact is concentrated on exposure in early childhood. So as we move through this x-axis towards the origin, particularly starting around age 5, more exposure to food stamp leads to an increase in outcomes or an improvement in outcomes. We don't find much marginal benefit at the older ages in childhood, number one. And then lastly, once we get over to the far left part of the diagram, these are tracing through the period where food stamps was implemented prior to conception. And we wouldn't expect having more exposure to food stamps before an individual was conceived to have an impact. So it becomes a sort of pre-trend test that looks like good news for the exogeneity of the treatment. So with that—
Sorry, just to let you know, you have about 2 minutes left.
Great. So we find this basic pattern of the importance of early childhood when we break down the results to the different domains: human capital, economic self-sufficiency, and neighborhood. Furthermore, to give you some idea of the magnitude, when we estimate a model that is looks at the sort of exposure of food stamps concentrated and that in utero to age 5 period, we get estimates such as having exposure to food stamps from conception to age 5 improves your health, human capital, education outcomes by 0.06 standard deviations in treatment on the treated. And you might say, I don't know how to wrap my head around what that means. So let me give you some takeaway estimates. So we find that exposure to food stamps increases high school graduation by about 1 percentage point. That's a treatment on the treated. About 4 percentage point increase in some college. We find that earnings increase by 7%, poverty rates decline, home ownership goes up. So we find very consistent impacts in terms of improvements in the long run across a wide set of results. Let me just conclude by giving a couple more nuances. One, with respect to results and differences by race and gender, we find that the economic impacts are concentrated more among white and less among non-white individuals. We find that the impacts on incarceration are concentrated among non-white men. The impacts on human capital concentrated among white men. So let me conclude by just kind of putting these estimates in perspective. So there's a growing set of estimates across different sets of the social safety net in terms of impacts on the long run. We find that the magnitude of our results, such that they can be compared to the existing literature, show somewhat smaller estimates than Head Start exposure in terms of impacts on education, and somewhat larger estimates than Medicaid, where there are estimates for impacts on survival or mortality and on earnings. And so finally, we estimated impact of the marginal value of public funds, a sort of benefit to cost ratio that shows very favorable impacts for this food stamp exposure and its impacts on children in the longer run. So thank you very much for giving me a chance to talk with you about my work.
Great, thank you so much, Hillary. That was wonderful. So next up, we have Discuss It, Manasi Deshpande.
All right, thank you very much. So it's great to be here to discuss Hillary's paper. I was already familiar with this paper, but it was great to get an opportunity to read it more closely and think about it and really appreciate, what an amazing contribution it is in terms of data linkages and new evidence on the food stamp program. So let me just start by summarizing some of what Hillary mentioned. So this paper finds large effects of the introduction of food stamps. And, again, this is I think a really major contribution because the authors are bringing this administrative data linkage to bear. And so the primary benefit of that is that they can estimate precise effects, which is very challenging in survey data. And they're looking at a wide range of outcomes, education, labor supply, longevity, incarceration. So we get a really expansive picture of the effects of this program. As Hillary mentioned at the very end, they estimate a large marginal value of public funds. And I should note, right, that that's excluding the ex-ante insurance value from this program. So if we think that there is a value just to knowing that this program exists in case somebody falls below a certain level, that MVPF won't even include that ex-ante insurance value. And so if we included it, it would be even larger. And as Hillary said, right, this is part of a growing body of evidence that early childhood investments have large dividends. And what I really wanted to spend time on today is not necessarily the methodology, which I think is great, but thinking about, what do these results mean for today's safety net, right? So the authors are evaluating this program as it was rolled out in the 1960s and 1970s. And I wanted to think a little bit about, what does that mean 60 years later for our social safety net today? And so I'm going to touch on two things. One is thinking about the current policy setting versus the policy setting of the 1960s. And then the other is talking about mechanisms. So in terms of policy setting, right, I think the main thing is that this is a time when there was a fairly minimal social safety net. So this is a time when the war on poverty is being waged. And so we would expect the first dollars of social safety net spending to have the largest returns if, as a society, we kind of know what we're doing, right? That we're directing resources to the places where they're most needed. So an example of this is the very nice paper by Anna Azer and co-authors on the Mother's Pension Program, which was really one of the very first welfare programs in the United States in the 1910s and 20s and 30s, and they find very large effects of that program, maybe not surprisingly, because right, we expect that first dollar to have the biggest impact. And so if we think about, what would happen, how do the effects of the food stamp rollout apply to what we would see today for an expansion in SNAP or a universal child credit or something like that, right? So this graph is from the Congressional Budget Office. It's showing over time, I couldn't find something quite back to 1960s, but this is going back to 1972, how much are we spending both in absolute terms and as a percentage of GDP on means tested programs, healthcare, cash assistance, nutrition, housing, and education. And so this is, first I should say, this is only federal spending, right? So it won't include education spending, which is mostly at the state and local level. We can see that
honestly, just to let you know, you have about 2 minutes.
Okay, thank you. There's been an increase even as a percentage of GDP since the 1970s. On the other hand, right, if we look at the particular programs that have been expanded, we can also see that these programs have been targeted at specific households. So in particular, supplemental security income, right? So households that have members with disabilities, as well as the earned income tax credit, households where the adults are working. And so there are families that are going to be left out of this social safety net, right? And in particular, families that don't have a working member. We know that extreme poverty has increased. And so, I think it's important to keep in mind that even though we might expect a lower return today because there's a higher safety net, there are also quite a few families that are left out of the safety net today. And we might expect to see large effects for those families in particular. And then on mechanisms, the main thing that I wanted to note here is that I think it'll be important to understand in more detail, how much of this effect is operating through an increase in household resources versus more parent time. So Hillary has another previous paper with Diane Schanzenbach in which they look at parental employment and hours and find that the food stamp program reduced employment and hours, especially for single mothers. And so that means that what is the treatment here? It's some increase in household resources, but it's also potentially some increase in parent time with the child. And I think a key question for public policy, not just about food stamps, but more generally, right, is would those beneficial effects that Hillary and her co-authors find have been larger or smaller if there had been no change in the mother's labor supply? In other words, this trade-off between household resources and parent time. Okay. So just to summarize, implications for today's safety net, I guess my main thoughts are that I would expect to see still likely large returns from an expansion in SNAP or universal child credit, even if they're not as large as the effects of the initial food stamp rollout that Hillary and her co-authors are estimating. And that's based on, first, just the rollout effect itself was very large. So even if we see something a little smaller, it's still likely to be substantial. And then second, the fact that today's safety net is quite targeted at specific households suggests that there are still households that would benefit from an expansion like this. And then also just mentioning that the increase in household resources versus parent time is going to be important more broadly for the design of the social safety net. All right, I will stop there, and thank you for the opportunity to comment.
Thank you so much. That was wonderful. So next up, we have Scott Nelson presenting Tax Refund Uncertainty, Evidence and Welfare Implications.
Great. Thank you, Liz, and thanks everyone for joining us today. This project is one that Equitable Growth generously funded when the three of us, that's myself and co-authors Sydney and Dan, were graduate students together. We're now freshly minted junior faculty, excited about wrapping this project up. What we look at in this project is this fact that one of those programs mentioned in the prior two talks, the EITC and like it, the child tax credit, generates large, usually one-time payments at the time of tax refund receipt. When I say these are large payments for a typical EITC recipient, your tax refund is more than 1 month of annual income. However, the rules determining the size of that refund are quite complex. And this has the potential to generate uncertainty for households about what refund check they're going to receive every year. We ask in this project, how much uncertainty do tax filers face about their annual tax refunds? What drives this uncertainty? And then finally, how costly is this uncertainty? Our strategy to get at those three questions is to partner with a volunteer income tax assistance tax preparation site, where we're able to survey tax filers directly on their expectations about their tax refund. We ask them both a simple point estimate question like, what do you expect your refund will be? And also a distributional question, which involves questions like, what do you think the chance is that your refund will be under 500, 500 to 1,000, 1,000 to 2,000, and so on, to get a sense of how much uncertainty they face about different potential outcomes. Then through this partnership, we're able to link those survey responses with administrative data on current and prior tax returns, and also a panel of credit report data to understand both the accuracy of those expectations and the financial implications for different households. We also ask how these expectations appear to be formed or what factors drive this uncertainty. We find that uncertainty appears related to more complex features of the tax code. So households with children, married households, households with substantial changes in income during the prior year all face larger uncertainty, make bigger, quote, errors, which is where their estimate is a farther distance from what their actual refund will be. Then, motivated by this evidence that there's important heterogeneity in uncertainty, we ask, how costly is it? We have two approaches to get at that question. First, we use our data on credit reports to look at how households borrow and save around the time of tax refund receipt. We're looking just for evidence that households respond on their balance sheet to uncertainty about future income. There are strong predictions that a household facing more uncertain income will save more to smooth that or borrow less out of that future income. So we look for evidence of that. And then motivated by those results, we finally use some modeling tools to try to get an estimate of the welfare losses from that uncertainty. You could think of this as saying, how much more would the EITC and similar tax credits be worth to households if there were no uncertainty in those payments? It functioned more like, say, a universal basic income or UBI, where you know exactly what that transfer will be. Here's a preview of the key results on those three questions. First, with regard to what households' expectations look like, we find expectations are first. This is important for the interpretation of the rest of the paper. First, accurate. So households are strikingly aware of what their refund is going to be on average. So the average, quote, error in the expectation is less than $100. That doesn't mean that every household gets it exactly right. To the contrary, the mean absolute surprise is almost $1,000. So you can think of there being a distribution of expectations centered at the true value with a lot of mass in the tails, where those are the filers who get a surprise. So about 30% of tax filers face a surprise of $1,000 or more. A quarter of tax filers report that they are, quote, not at all certain what their refund will be. We also find that uncertainty is, quote, accurate in the sense that more uncertain filers indeed have larger ex post surprises. So people know that they don't know what their refund will be. Second, as I mentioned, we find that uncertainty is related or appears related to tax complexity, especially features of the EITC, such as the EITC's famously complex phase in and phase out regions for different household sizes. Then when we ask how the uncertainty has consequences for financial behavior, we find evidence for precautionary motives. We find that more uncertainty correlates with less smoothing of the tax refund. Concretely, we look at how much households appear to borrow out of that tax refund based on credit report data ahead of time than to pay it back later. And our headline estimate of the welfare cost of this uncertainty is that it's about 10% of the value of the EITC. So we can think we could get 10% more, you can think of it as well-being, or you can put it in dollar terms, into these targeted households' hands if we were able to make the EITC and similar transfer payments sort of a more transparent or anticipatable program. So this is great. I've shared with you all the headline results I wanted to emphasize today. And what I get to do in the rest of my time is just fill in some details and color of how this all worked in practice. I'll start by thinking just where this fits into some other work on the EITC, expectations data, precautionary motives, and so on. One thing I want to highlight is that, including very important work by Hillary, the first speaker today, there is a rich literature on to what extent the EITC strengthens households' incentives to go work more. And while that debate is ongoing, we're sort of entering with a complementary question as, regardless of whatever the incentive characteristics of the EITC are, what are the insurance value characteristics of the EITC, in the sense that a more transparent EITC could potentially both enhance its labor supply response and improve its insurance value. So that's one thing I want to highlight there. I'll move next to provide some more details on the data and the setting, because being able to link data like these was one of the things that made this project possible. We found a VITA tax preparation site that was willing to link both some existing surveys that they already ran on their clients and other credit report data that they collected with clients' consent. And then we were able to one-on-one, I and my co-authors were there for all of our interviews with these clients. We would get their consent to participate in research, and that would kind of start this whole panel analysis where we ask their expectations about their tax refund. Then we'd see what the tax refund actually was. We could compare it to their tax experience the prior year, and we could follow their panel of credit report data from that point onward. Overall, I won't touch on the summary statistics just today, but overall the panel is relatively financially distressed, largely subprime in terms of credit score consumers. The average AGI, or adjusted gross income, in the sample is just over $20,000 a year. I'll next share some details on how we collect these belief data. I mentioned in particular that we had this question about quantitative measures of uncertainty. We say, what's the % chance that you think your refund could be, say, 0 to 500, 500 to 1,000, and so on. I want to click through just to this detail slide here to show you what we do with that. The green dotted line shows a hypothetical answer to that question, where people put different amounts of probability mass in different regions of the potential distribution of their refund amount. We then fit a distribution, we experiment with several different flexible ones, to those bins in order to get consistent across consumers quantitative answers to how much uncertainty they face. What we're looking for is basically how much mass is there in these tails to think about how much uncertainty people face. People seem to—
Scott, just to let you know, you have about 2 minutes left.
Great, thanks so much. People seem to understand these questions reasonably well. We worked on several different VITA sites until we found one where we found these questions were working well. 85% of respondents, for example, used multiple of these bins to report. This just shows that people on average are pretty much spot on accurate with what their mean expectations are, whereas the amount of uncertainty that they report is also strongly correlated with how much ex post surprise they face. So people know that they don't know about what their refund will be. We look at sources of uncertainty. I'll just highlight results here. As I've mentioned, they appear correlated with more tax complexity, which includes filers with dependents, married filers, and filers with large past year changes in income. And I'll refer you to the paper draft for more details on that analysis. So the final part of this paper, it says, what are the consequences of all this uncertainty? We compare changes in credit or borrowing balances on this panel of credit reports with the timing of tax refund receipt, basically a diff and diff framework across households that are exposed to more or less uncertainty. We find that for each $1,000 of standard deviation from those fitted distributions that I described previously, households borrow about $250 less out of their anticipated refund. So this is a substantial a change in consumption smoothing for a household that's earning, say, $20,000 a year, when they have one standard, sort of $1,000 higher standard deviation of their subjective beliefs. Finally, in a welfare model where we just think of a household solving a standard economic consumption saving problem where they're trying to smooth how much they consume, or basically you can think of food on the table from month to month, we take some kind of standard parameterizations of how a household we think is risk averse. That is, they don't like having consumption go up and down, how much it costs for them to borrow, what rates they can save at, and so on. When we crank our estimates of uncertainty through that model, we get estimates of what the total costs of this uncertainty are. And so a headline number to share is that for an average EITC recipient, the cost of uncertainty range from, say, $150 to $300, depending on what exact parameterization of the uncertainty we look at. Great, so I'll just wrap up there, highlighting our answers to those three main questions I pointed to. Tax filers are uncertain. This source of uncertainty appears related to the complexity in the tax code, and the costs of this uncertainty are substantial. In fact, if you take that 10% value of the EITC and inflate it just to think what this might cost if we extend that number nationally, there's about $7 billion nationally in welfare cost just from the uncertainty that appears to potentially be related to complexity in the EITC.
Great, thank you so much, Scott. And I'll just remind audience members, please feel free to go ahead and put questions throughout the presentations in the Q&A box. And with that, I will hand it over to Derek Wu for welfare cuts and well-being, evidence from Indiana in the Great Recession.
Great, thanks, Liz. And I'm gonna just go ahead and start, and if you can't see it, just give me a shout out. Thanks very much for having me on the program, and also for the funding, and thanks in advance to Alex for discussing. This project studies welfare cuts and well-being, looking at evidence from Indiana during the Great Recession. This is quite literally work in progress, so I'm looking forward to the feedback as well as the discussion later on. Okay. So the motivation here is that government programs often come with many administrative burdens, whether it's having to fill out a complicated application or having to physically go somewhere for a face-to-face interview. Over the past 2 decades, and partly in response to these burdens, the trend in social service administration has been towards making programs more virtually accessible. In general, being able to apply for benefits virtually can be a good thing, but the automation of welfare services can itself lead to more burdens. And this may be especially true when the management is handled by private companies or nonprofits, as is often the case with differing goals and expertise. So in this project, I study a natural experiment in Indiana, which in 2007 attempted to automate its welfare services, covering SNAP, Tanf, which is cash welfare to families with kids, and Medicaid, by outsourcing their management to the IBM Corporation. IBM used online and phone platforms to replace face-to-face interactions with caseworkers. And instead of making it easier to apply for welfare, this led to burdens of a different kind, namely a lack of personalized assistance from caseworkers, which led to more application errors, and which was compounded by a zero tolerance policy for errors, meaning lots of folks were denied benefits because of minor mistakes like missing a pay stub to validate one's income, as well as long wait times at overwhelmed call centers. And it turns out that this system was rolled out to 2/3 of Indiana's counties over multiple waves between October 2007 and May 2008, before it was suddenly halted in 2009 as a result of performance problems. And so the counties in color received the treatment at different stages, depending on the color shading, and the counties in gray never received treatment. So this meant that counties were naturally assigned into treatment and non-treatment groups whose outcomes can be compared over time. So I view this project as trying to answer 2 sets of research questions. First, what are the effects of the automation effort on the take-up of SNAP, TANF, and Medicaid, and which folks were screened out the most? And second, what are the broader impacts of the welfare cuts stemming from this effort on incomes and a whole host of other well-being measures like health and financial solvency? And today I'll show you some early results for bullet 1. So to the best of my knowledge, this is one of the first studies to empirically examine the drawbacks to either automating or outsourcing the administration of welfare programs. This is despite systems with similar features appearing in many other states. This project also examines a novel natural experiment whose setting contains several important features. First, these burdens apply not only to new applicants, but also to recertifiers. These burdens affect access to multiple programs simultaneously. And this project studies the potentially long-term impacts of temporary burdens, given that the system was in place for only 2 years before it was disbanded. More broadly, this project follows those losing a program, while the vast majority of past studies assess the impacts of gaining a program. And given that the setting occurs during the Great Recession, when the insurance value of transfers was very high, the loss of welfare may have been especially consequential. And finally, some of the burdens in this setting, namely the lack of personalized assistance and the long wait times, draw stark parallels to the uncertainty and delays faced by unemployment insurance applicants during the COVID-19 pandemic. So let me talk briefly about the data. The results I'll show you today rely on public use data, primarily county level data on enrollments for SNAP, TANF, and Medicaid. In ongoing work, whose results I won't show today, I use linked survey and admin microdata that are made available through the Comprehensive Income Data Set, or KID for short, which is a database that I've been working on with Bruce Meyer at the Harris School and a team of other researchers to build at the Census Bureau. So these data include longitudinal SNAP, TANF, and Medicaid enrollment records for the University of Indiana recipients linked to a variety of outcomes, including wages and incomes from IRS W-2 and 1040 forms, benefit amounts for other government programs, mortality from the SSA's Nubident, migration from the 2010 census, as well as demographics from the ACS. And other data sources that are not currently part of the KID, but ones I'm hoping to bring in, include various measures of financial solvency and hospital discharge records. So the natural experiment motivates two empirical strategies for identification. I'm going to focus today on the diff and diff design, which exploits the fact that counties were naturally assigned to be either treated or untreated, and whose outcomes can be tracked over time. So let me just dive right into some of the results. So this figure shows the effects of IBM's automated system on the log number of SNAP cases in the treated counties. My preferred estimates control for total population and demographic cuts. And so these estimates are what the 95% confidence bands correspond to. But I also show estimates that don't control for anything and control only for total population. So you see no pre-trends in the 12 quarters preceding treatment before a sharp drop of around 15% in SNAP enrollment pretty quickly after the automated system is rolled out. This decline then reverses somewhat in the ensuing quarters. But what's kind of remarkable is that there never seems to be a full recovery, even if you look 7 years out. So this suggests some level of permanence in the reduction of SNAP receipt in the treated counties that persists beyond the immediate life of IBM's automated system. Why we don't see a full rebound is a key question that I'm investigating. This could be a result of those being unable to access SNAP, working themselves out of eligibility. It could also be a result of folks moving away or even passing away. And it's worth pointing out this gap that opens up between the estimates that control and don't control for population changes, which is informative since the population controls could absorb to some extent effects on mortality and migration. Moving on to TANF, you see an even steeper drop of around 30% initially in TANF receipt compared to SNAP. And one of the potential reasons for this, for why this initial drop is large, is that TANF work requirements are more extensive. And so that may require increased paperwork and therefore more opportunities for mistakes. But if you extend the post-treatment window to 7 years, you see essentially a full rebound from the initial decline. So why might this rebound exist for TANF but not for SNAP? One reason is that given lifetime caps on TANF receipts for most adults, there is continuous turnover among TANF recipients, meaning many of the recipients initially cut off would have stopped receiving TANF 5 years later anyway. Another reason could be that those eligible for TANF tend to be non-elderly adults and young kids who may be less at risk of dying than elderly or disabled folks who are eligible for SNAP. And in fact, you don't see much of a gap here between the estimates that control and don't control for population changes. Finally, for Medicaid, you once again see a noticeable drop in receipt, but this decline is more modest than the reductions for SNAP or TANF. And once again, there's a level of permanence in the reduction of Medicaid receipt that mirrors to some extent what you see for SNAP, as well as this gap that opens up between the estimates that control and don't control for population changes, suggesting potentially a role for mortality or migration. And the similarity in patterns between Medicaid and SNAP shouldn't be surprising given that they target similar populations. So as far as additional results go, I find that the counties with smaller populations and higher poverty rates tend to see larger declines in welfare receipt, even after controlling for other characteristics like rural status and unemployment rate. I also find using the ACS that the households screened out tend to look more needy. So they have members with physical or mental disabilities, they have lower education levels, or they have circumstances that may require more complex paperwork when certifying eligibility. So for example, they have kids, they have non-relatives in the household, they recently moved, etc. What's striking though, is that looking across a whole host of demographic and socioeconomic groups in the ACS, there wasn't a single group for which SNAP enrollment increased significantly as a result of the automated system. I also conducted a number of robustness checks to test the assumption that treated and untreated counties would have had similar trends in outcomes In the absence of treatment, I showed in the prior figures no pre-trends when using a pre-treatment window of 3 years, and that persists when using a longer window. Counties also experience similar patterns in economic conditions before and after treatment, which is important given that the Great Recession could have been a time-varying shock that affected these counties differentially after treatment. And even during prior recessions, these counties tend to have similar patterns in welfare receipt and unemployment rates. Placebo tests.
Just to let you know, you have 2 minutes left.
Perfect, thank you. Placebo tests show that these counties experience little to no overall enrollment differences in programs not under IBM's purview, like Medicare and school lunch, nor the number of households eligible for SNAP, as simulated from the ACS. And finally, a synthetic control analysis comparing Indiana to other states finds estimates that are consistent with the different results in magnitude that compare counties within Indiana. So as far as the next steps go using the confidential microdata, which I'm pretty excited about, my plan is to take a deeper dive into the effects on welfare take-up and targeting. This includes decomposing the overall enrollment changes into the enrollment of new recipients and the retention of existing ones. Of those disenrolled, how many turn back onto welfare and how many remain off permanently. I also plan to look at how changes compare between single and multi-program recipients. These data also allow me to examine targeting across a wide array of pre-treatment attributes. And by linking these records to the ACS, I can assess how accurately surveys capture changes in program receipt in response to an exogenous shock. I then plan to examine the broader effects of these welfare cuts on well-being, seeing whether they induce individuals to increase their labor supply at all during the recession, and also whether or not they turn to other forms of insurance, including other government programs in the absence of SNAP, Tanf, and Medicaid. These changes in earnings and other program income can serve as mediators in helping to understand the broader effects of welfare cuts on health, on financial solvency, migration patterns, as well as future incomes of current adolescents. And let me conclude, and thanks for listening.
Awesome, thank you so much, Derek. So next up, we have Alex Bartik as the discussant for both Scott and Derek's papers. And Alex, I think you're still,
yeah.
Oh, there you are.
All right, cool. So thanks so much for having me. I'm really excited to talk about both of these papers. I think sometimes it's quite hard.
Sorry, Alex, I don't know if others are having this problem, but you kind of went out and we can't hear you.
Yeah, I accidentally unplugged my mic. Can you hear me now?
You're good now.
Okay, cool. It's the cons of remote stuff. So, I mean, it's oftentimes hard to discuss two papers, but I actually thought these were two really cool papers to discuss together, because I think, at least for me, thinking about them together suggested kind of some areas of thinking about kind of social insurance. I think I've been kind of at least kind of underemphasized in the recent literature, and kind of, I think, discuss some interesting paths for both papers going forward. So, it's two papers, so I'm going to try to briefly summarize both papers. I also have kind of a couple comments for each paper that are specific to each paper, and I'll try to kind of go through those. And then at the end, I'll try to talk about how combine the two papers, got me thinking about how we might want to think a little bit more about how within individual, the kind of size and receipt of transfers might vary across time, and how kind of administrative rules for how transfers are administered might kind of affect the implications of that variation for the welfare impacts of these transfers. So first off, Sydney, Scott, and Dan's paper, Scott already ably summarized. What they're going to do is they're going to, survey, I think in a very clever way, survey tax filers who are coming into Vita centers in Boston about their expectations about their EITC payments. They're going to link this to tax and credit records going back and a little bit forward. And they're going to use this to estimate, you know, in a reduced form way, the effect of uncertainty and variability in the EITC payments on financial behavior. And then they're going to calibrate kind of a 2-period model to kind of estimate the welfare effects of this uncertainty. And they find kind of 3 big things, you know, which I think all, you know, are all interesting and not necessarily what I would have expected. So first, there's just like substantial uncertainty in the expected refund amount, as Scott highlighted. You know, even for households that, you know, have received EITC before, it's not like this is like necessarily like a totally new program to them. You know, there's just substantial uncertainty about how large the transfer is going to be. And this uncertainty has kind of real consequences for folks' behavior. Specifically, more in certain households are borrowing less. You know, so although you can't 100% say, but consistent with those households, kind of, you know, keeping consumption somewhat depressed because they're uncertain about what their kind of total income will end up being. And the model calibration suggested the combined kind of uncertainty and kind of just kind of fundamental variability in the EITC payments reduce the aggregate welfare benefits of the EITC by 9 to 17%. So this is not just kind of an object of academic interest. Kind of, if these results are true, then kind of this kind of feature of the EITC, or at least as it's currently administered, is having kind of a non-trivial effect on kind of how much benefit the recipients get from the program. The second paper kind of does a very different approach and style of paper, but I think actually kind of teaches us something very complementary. So there's kind of this very interesting and basically, as was outlined during the talk, kind of disastrous rollout of this automated administration of social insurance programs in Indiana starting in 2007. This new system basically replaced an in-person caseworker system, and basically there weren't enough people staffing the call centers, and the automated system basically kind of automatically rejected people even who had small filing errors, like requiring them to totally refile. And what he's going to do is that he's going to use this variation in the rollout of the system, because it was rolled out kind of by groups of counties before it was canceled by the end of 2009, to estimate how this kind of change in the administration of benefits kind of affected take up and targeting effectiveness of these 3 transfer programs that were affected. Long run, as he discussed, he also has plans to kind of link this with kind of other data to kind of get a richer, to use this variation to get a richer sense of the effects of these programs. And this automated system kind of had kind of dramatic effects on SNAP, TANF, and Medicaid rolls. They fell 15, 20%, and 6%. So these are really large falls. And although there was some bounce back as the program was kind of unwound, Medicaid and SNAP receipt remained about 5% lower 5 years after the automated system was disbanded, right? So there's kind of these really kind of persistent effects of kind of this one-time change. And the automated system, didn't seem to be particularly, targeting people, well, at least according to most normal metrics. If anything, it seemed to be particularly likely to screen out SNAP recipients with children, mental and physical disabilities, and low education levels. So now I'm going to go, and so kind of like this was kind of like this very sudden and big change, in a lot of different counties in Indiana about kind of like, who received these benefits. And I think importantly, for what I'm going to talk about later on, it affected both kind of new enrollees and people who are already enrolled in these programs. So both there were kind of new people who are not able to get on the program, and existing recipients kind of lost access to the programs. So now I'm going to make a few specific comments just having to do with kind of some of the details of each paper, but like before trying to do some work to kind of connect these 2 papers and think about what they say overall. So the first comment about the presentation from Caldwell, Nelson, and Waldinger is that one thing I didn't quite have a sense for in terms of interpreting the results is, how do we think about whether folks coming into VITA centers are particularly uncertain or do they have particularly variable EITC claims? Like you're kind of using these estimates of the distribution of uncertainty and how much the EITC payments vary to think about the overall welfare effects of the program, which I think is, interesting and exciting. But, I could imagine a story where it's people with particularly uncertain claims who come into the VITA Center, right? So are you getting an upper bound for the welfare cost? Or I can imagine selection working a different way. So I don't know how exactly you get at that. I mean, it's a different time period. It's hard. You can imagine trying to do some simple online survey now of like an overall population, do those variability, even if you can't link to your admin data, but if you just want to look at the kind of this distribution of uncertainty about the EITC, do you see something similar in kind of a more externally valid population to what you see in your population who's selected into going to the VITA Center? And this is like the biggest, like, how much do I take away from these results question that I have is like how much because I'm worried in particular about selection into getting help on uncertainty, right? And I think that's like something that I think you guys might want to think harder about how to address.
Alex, just to let you know, you have 2 minutes.
Okay, this will be fun. Okay, so maybe I won't get to my combined comments. So the second thing is the variability component of the CV calculation right? From what I could tell, it wasn't clear if you allowed the refund amounts to co-vary with take-home pay. But like that's kind of the point of the EITC is like, I mean, it varies with co-varies with take-home pay in specific ways, and it just seemed like you were drawing the refund draws separately from take-home pay, but it's like not how the EITC works. And so you just might want to think about that because I think that's going to be crucial. That can make the welfare effects worse or better. And so I think it's like in your appendix, but I think thinking through how you exactly model that covariance is really important. My big comments, I'm going to skip like the last smaller comments for Derek, but my big comment for Wu is that I find it really interesting that the effects on SNAP and TANF were much bigger than Medicaid. And I was kind of curious if you could kind of dig into why, right? Is this because Medicaid is really big expected benefits? Is it was like some nuance with how the Medicaid application process was affected relative to others? So I try to think about that. Second, it's a classic case of multiple treatment dates and diff requiring care about what's the control group. Like, and so you should look at some of the Goodman-Bacon and associated papers on that. Third, I was curious, what happens if you move? Like some counties weren't treated. And so could I move to a non-treated county and get a caseworker? Again, like there might be some weird kind of welfare magnet migration dynamics trying to figure out where I can actually get a caseworker and get my benefits sorted out, particularly like, in the end, it's not that big of a state. So people might be trying to kind of adjust where they are to take advantage of where the benefits are. And the big thing I want to highlight, and I don't have time to go through this in detail about putting the papers together, is I think they both highlight even for people who are on a program, there's actually a lot of uncertainty over time in the magnitude and whether you receive at all a benefit. And so I think a lot of targeting lists tried to focus on like, okay, we're going to give a program to some people in one time period, and we're going to think about the properties of that. But like over time, some of these kind of targeting policies might affect the kind of variability and the size of transfers of people who are on the program. And so kind of thinking through about how the variation kind of within person in transfer receipt and magnitude, I think is an interesting thing to think about for these things going forward. So for the Caldwell paper, I think thinking about how the EITC uncertainty and variability kind of co-varies with income variability kind of over time in terms of like determining kind of the welfare effects of the EITC is really interesting. And for the other paper, I'd say that I think a lot of your questions were about thinking about how this administrative change affected people who lost benefits. But I think thinking about how it affected people who kept their benefits, because it might have changed their perception of like the risk. Maybe now I think there's a 20% chance there's going to be some rule change next year and I'll lose my benefits. And that actually might have changed a lot people's kind of ex ante views on kind of how much this program is helping them consumption smooth. If I think that there's in each time period some risk that there might be some rule change or policy change that's going to change my benefit amount. So I think trying to think about kind of how these details affect kind of how even recipients kind of how kind of within the recipient these programs allow people to smooth consumption, I think is an interesting direction for kind of both papers to look at going forward. And it was really fun to read them. I kind of view them as very complementary, and I'm excited to see where both papers go.
Awesome. Thank you so much for that, Alex. And so we have some really great questions from the audience, which I want to get to in just a minute. But if there were any questions or comments raised by the discussants that presenters would like to take the opportunity to kind of like briefly address, I wanted to give you all that opportunity first.
Manasi, as always, was fantastic. I really appreciate the comments, and I'm happy to continue the conversation in the Q&A.
So I'm glad they were helpful, Hillary.
Awesome. Well, if there's nothing else, we can just dive right into some of the great questions from the audience that we've gotten. And Hillary, I'll actually start with you. One of the questions we got is, very curious for Hillary to unpack the concentration of impacts going to Blacks, whites for different measures. What should we take away from those racial differences?
Yeah, it's a great question. I mean, I have to say going into it, I certainly had the expectation that we would be getting, especially just like in the intent to treat analysis, that we would find larger impacts among Black potential recipients because of their higher rates of participation. And, you know, we're having this sort of interesting set of findings that I didn't, you know, have a chance to really show you, where we find larger impacts on incarceration and on mortality among the Black Americans, and lower impacts on education and economic self-sufficiency. And one of the ways that we're trying to make sense of that is it sort of gets back to, you know, Manasi's original point about the time period when these policies, when our, you know, our treatment is occurring. And, you know, we know that, you know, the 60s and 70s was a period of incredible changes in things very important that might be very complementary to our findings around school investment. So one of the puzzles that we have that we hope to go forward and analyze more fully in a subsequent paper is, to what degree are these impacts in the long run that may be particularly important in these early life nutritional investments? To what extent do those need to be paired with ongoing investments, maybe particularly in school settings, in order for these things to translate to the outcomes that we're looking at, particularly in the economic domain? So it's not a great answer, but it's where our thinking is going in terms of ways to try to investigate and test those hypotheses.
So actually, Hillary, that's a great transition. I'm going to ask one more of you because it's, I think, a little bit related to what you were just saying. And so the question is, on the Hoynes finding that young children see the biggest returns to SNAP investments, what does that imply about targeting SNAP benefits? And if we focus on targeting households with young children, where does that leave households without kids? And I would just add, I would be interested in your thoughts too on, you know, you, I think, set out a really interesting and good framework at the outset of talking about this in terms of investments. And like return on investment is one way you can think of this too. And so again, what do the findings being concentrated among really young kids kind of, you know, how should we think about that if we're taking this investment perspective?
Yeah, I mean, there's, you know, I have to say that I would have thought that the benefits, the marginal benefits to more exposure, my hypothesis going in was that these impacts would be not just concentrated at the younger ages. And one of the reasons why is, you know, like we have these other results more from the education literature that show more kind of direct, more contemporaneous effects of nutrition on performance in school. And so you would have thought that children who don't have adequate nutrition when they're in school would certainly affect their impact to gain the benefits of schooling. So from that framing, one would have thought. that these benefits, if they existed, would be prevalent maybe throughout childhood. And so I guess my thinking on this, although I haven't come up with a way to test it, also gets back to one of Manasi's points about what the underlying context is. And, you know, she was emphasizing the very valid point about what the underlying environment is of other social safety net benefits. The way that this kind of question comes in for me and thinking about an answer to this excellent question is, it is true that the original food and nutrition program in the United States that pre-exists SNAP is school lunch programs, which there was a federal school lunch program that actually came out of World War II and kind of pre-existed the sort of modern food and nutrition program. So the question is whether that underlying kind of context of what children would already have available to them, which is packaged with being at school, is part of that issue around the timing. And I haven't figured out a way to test that yet, but that's certainly one of the hypotheses that I have up here. Thank you.
That's really interesting. Thank you so much, Hillary. So Scott, I'm going to move to a couple of the audience questions that we got for you, and I'll pose them both to you simultaneously, and you can take them in turn. So the first one is regarding the commoners paper finding that certainty on EITC amount/consumption smoothing enhances welfare. How does this square with qualitative research that finds that many low-income families welcome the lump sum/surprise nature of the EITC refund? And then the second one, kind of actually very related, is for Scott. One argument offered for the lump sum nature of the EITC is that it helps taxpayers save. To what extent does your experiment shed any light on this hypothesis, and how would behavioral mechanisms like this affect your welfare estimates?
Great, thanks, Liz, and thanks for the really interesting questions. It was striking both after reading some of the sociological and qualitative research on the EITC and thinking of sort of early, very survey-based measures about how EITC recipients view the EITC. It was interesting to be in the VITA site and experience how much, on the one hand, there were days of elation, where it's sort of, oh my gosh, this is, because people file right there. We survey them, and then they file, and then they know what their refund is going to be. There were days of, oh my gosh, this is a much bigger refund than I expected. And there were days where people were really facing substantial financial concern based on not receiving the refund that they had really anticipated and in many ways relied on. And we have no way in this research paper or the survey we ran to get at exactly whether people enjoy that kind of something that feels a bit like a lottery ticket or not. I think just based on other research, personal introspection, and the experience of being there that day, or all those days, I think those times you lose the lottery may not be worth the times you win the lottery. But of course, this is one paper and a broader agenda on this, and I sort of welcome and I'm excited about other research to kind of study that dynamic. It is interesting when you think of how research on how EITC and tax refunds more broadly get spent. There is some work suggesting that the sort of spending response to a refund surprise or something like that may be treated differently than sort of more anticipated income in terms of how much it gets saved or spent. And of course, there's a range of perspectives on this, but it could be that moving these refunds to something that feels sort of less like a lottery ticket also changes the way that the money is spent. Although I would also just emphasize, I think it's important to take these households' preferences seriously and respect that they know best how to spend their money. And we're just trying to think of, given how complicated life is and how complicated taxes are, can we make things simpler? And so nothing in making these tax refunds more transparent would make it impossible for anyone to say have a not borrow out of the refund and then have the refund arrive later in this big lump sum if that's what they want.
So the next question is actually one I would be curious to get everyone's thoughts on. And I might, Derek, if you don't mind being put on the spot, start with you since you haven't had a chance to go yet, but then also anyone who wants to speak up. But this question is to all speakers. Can you expand on how one or more of these studies relates to the broader and emerging literature on well-being and other social sciences? Thinking both in terms of like individual and, you know, a family and like collective level. And I think that's a really interesting question because I think, well, I'll offer an observation, Derek, using your paper as an example of, you know, sometimes the design of the administration of these welfare programs is intentional and intentionally difficult and intentionally challenging for families to access. And oftentimes we, you know, think about the framing of these things as they're an inherent bad thing to be using. So we want to discourage use of the social safety net. But I think, you know, this question of kind of, you know, taking a step back and thinking about how, you know, these studies speak to actually if the goal is to improve overall well-being, not just economic well-being, perhaps, you know, what do we think this, you know, insight offers us? And again, Derek, I want to offer you the opportunity to go first, but also open to everybody.
Yeah, that's a good question. You know, I think one of the benefits of, I think one of the things that I'm excited about with my paper is kind of the ability to look at you know, various dimensions of well-being. You know, not just kind of incomes, but also things like kind of credit.
Oh no, Derek, you froze a little on us. Are you still there?
Credit outcomes would be reflect consumption or, you know, longer term kind of child outcomes. Yeah, can you hear me now? Can you hear me now? Okay, I'm still here. Okay, yeah. So I think one of the benefits of the paper that I'm working on is the ability to look at multiple dimensions of well-being. So not just incomes, but also kind of credit outcomes, consumption.
Oh no, Derek, you seem to have frozen again. Oh, I'm sorry about that. Do other folks, while Derek's...
and, you know, sort of mortality. Okay, I'm back, but I'm not sure it's going to happen again. Okay, so let me know if I freeze again. But I think it's important to look at multiple measures of well-being because there is a literature in poverty that shows kind of a lack of correlation between incomes and well-being, kind of material well-being measures. And you know, I actually have worked with Bruce Meyer on this, where you know we find that a big reason for that is because you know folks at the bottom of the income distribution underreport their incomes in surveys. But kind of the broader message is, you know, it's important to look at multiple well-being measures because of this kind of lack of correlation that.
Oh no, you froze again. You might try turning your camera off to help improve the bandwidth. But actually, we've got only just a couple more minutes left, so I wanted to see if there were other folks who wanted to respond.
Let me.
And Alex, did you have something you want to say?
I don't think I had anything in particular really. No.
All right. Sorry, Derek, if you want to give it one more try to wrap up. Sorry you kept getting interrupted.
Oh, no worries. I think what I'll just say is that you know, given this lack of correlation in the literature between kind of incomes and well-being, I think it's important.
Oof. Derek, I'm so sorry that we keep losing you. Yeah, I know it's an apt closing to 2020. So we are almost just at time. We're at 2:44. But if there were any final points or questions that the participants didn't get a chance to share with one another, want to offer you the opportunity to offer any kind of closing remarks or final thoughts.
Thanks for the opportunity. It was a really great coherent session. So thank you so much.
Yeah, thanks so much, Equitable Growth.
Thank you all. We really appreciate you taking the time to participate today, and really appreciate the really thoughtful and helpful discussions as well. And so sorry we had some tech challenges at the end there, but overall I thought it was a really great session. And thank you to our audience members as well. We got so many great questions from the audience. So hope everyone has a great rest of their day, and to see you all again on another Zoom screen at the rest of the conference sometime soon. Thank you.